Hello. Thank you for the opportunity to present and share this material with you. I am Dr. Martin Chin, and I'm an oral and maxillofacial surgeon in San Francisco. The purpose of this series is to introduce a new way to think about how to treat bone disorders. In this series, I will talk about a new concept, new discoveries in how bones operate within the body, and also using this new concept, how to design new operations to solve problems that previously were difficult or impossible to treat. The theory here is to use the method that the embryo employs to create the skeleton to begin with, to understand how this works, and then to use these techniques to design new operations to make surgeries work better. Why do we need this? Well, the problem that we have is that despite our large number of operations that are working just fine, there are many procedures that are not producing the results that we wish. We have patients coming to our office to find solutions to problems that were resistant to prior treatment. The purpose of this series is to open the minds of surgeons, clinicians, basic scientists, and patients to a new way to understand why bones heal the way they do, why they sometimes don't heal the way we think they should, and to introduce some new procedures to address some of these particularly challenging problems. So the purpose of this series is to introduce a method by which we can create new operations that will enable us to solve problems that have frustrated surgeons over many years. Patients and clinicians often find themselves in a difficult situation where, despite following the accepted protocols for treatment, the outcome of the treatment is unsatisfactory. Sometimes it's not clear why this is. So part of this series is to propose a method by which we can analyze procedures that do not work, and also have an ability to analyze proposed treatments and their probability of working before we actually perform them on our patients. Many of our patients come with the history of multiple procedures that did not work. These procedures are often performed by fine surgeons who followed the protocols rigorously, and the procedures were clearly done with technical excellence. However, we see that some of these patients simply do not heal. So those patients who have been frustrated by multiple failures in proper accepted treatments come with a special challenge to create new operations that will be able to satisfy and correct their particular disorders. Some patients come to us with problems that appear to be clearly out of the range that current technology can hope to treat them. These are patients with unusual or large defects, which we know from experience are going to have difficult times with the healing process. Some of these patients are discouraged when they present to their doctors, and the doctors simply say that the chance of working is limited, so that they don't really want to try to do the procedure at all, which is a fine and reasonable recommendation. However, these patients still are left with a problem which deserves treatment. Just because there is no current or acceptable treatment for these disorders does not mean one cannot be designed. It requires an understanding of the underlying biology to create operations that are specifically designed for these challenging patients. Because surgeons in the past have had difficulties treating some of these challenging and large disorders, there is no real history to use to create new operations. In this situation, it's necessary to fall back on our basic understanding of biology and science. And in some cases, we need to push the boundary of what is known in biology and anatomy in order to create new operations to satisfy these patients. Some patients come to us and they have problems that are relatively straightforward. However, their underlying medical conditions sometimes compromise their ability to heal an operation that would normally be straightforward. In these cases, we need to design special operations that take into account these patients' challenge in normal healing. Again, it is necessary to understand the basic biology of how the bones and soft tissues heal in order to design new operations. Over the past 40 years, I have tried to improve the way these operations are performed and propose alternative treatments when I have found that either myself or other surgeons have had difficulty getting certain disorders to respond to surgical treatment. The strategy here in this whole project is to incorporate science and clinical experience from many disciplines in order to create new operations and new theoretical biology to create a system by which new operations can be designed in a logical way. The objective of this project is to extend the boundary of what is possible in a clinical setting. When we are confronted with patients with either problems that appear to be too difficult to treat or ones that seem to have failed conventional treatment multiple times, we need a way to approach these problems in a deliberate and logical way to successfully treat these difficult problems, but also to use the science to improve the procedures that are done on a routine basis. In order to illustrate how this works, I have chosen 3 specific classes of surgical problem that confront us on a regular basis. These are problems that we see every day, and I chose these because they are familiar to most of the people who treat these disorders. Even though they are disorders that are common, they are often challenging and not always successful. These procedures are familiar to most practitioners, and therefore they provide a perspective in how their current experience compares to the experiences that I will demonstrate. So this is an explanation through clinical examples. The first set of patients have to do with a common problem of replacing some segment of missing bone in the jaws. It's common in maxillofacial surgery to be confronted with a situation where we are missing a segment of the jaw system and we need that portion replaced, the volume of living bone replaced, because it is necessary to achieve either a functional or aesthetic objective. The second class of operation is that of osseointegration. Placement of dental implants has been a very successful and commonly performed procedure for a number of years. The theory in which it works is well documented in many textbooks and in the literature. However, the underlying biology may be less complete than one would expect. Just because these procedures will work and are relatively stable long term, it doesn't mean that the understanding of the biology by which they work is really understood. I am proposing a different theory, a different way of looking at how osseointegration is established, how it is maintained over many years, and what are the mechanisms by which osseointegration fails. So instead of assuming that we understand how this system works, the theoretical bond between titanium dental implants and living bone, I am asking for the audience to keep an open mind, to have at least a suspicion that we are not as smart as we think we are on this issue, that all of the details that we have been taught in our school and in our courses may be less than complete. I will show cases that illustrate why it is that there are deficiencies in our understanding of this process. I will also show clinical examples that illustrate important clinical situations where an understanding or an alternative understanding of how osseointegration works can benefit patients, especially those who have had difficulty achieving successful results with osseointegration therapy. The third class of disorder is periodontal disease. Periodontal degeneration or periodontal disease involves the deterioration of the anchorage process by which teeth are secured in the jaws. There are many treatments to deal with the issue of periodontal degeneration, that of bone loss and loss of the suspensory structures that hold teeth into the jaws. I will show alternative methods to create procedures, design procedures that have the ability to regenerate periodontal structures which are difficult or impossible to manage with conventional treatment.